Hey everybody, it's Dr. Thompson. Welcome to week 4. We're just about to get started with a very interesting week. So there's going to be two big topic areas that we're talking about. The first one has to do with self-disclosure. Self-disclosure has been a very controversial area for psychotherapists over the years, and there's been widely varying opinions about whether we should disclose anything about ourselves personally in the context of counseling and psychotherapy. When I was going through graduate school, I went through psychoanalysis as a patient as a part of my training. And my psychoanalyst rarely said anything about himself personally. Now, on the other hand, there are people that think we should freely and widely disclose about ourselves. So what we're doing this week is going to give you a chance to think about some of these issues for yourself. So in the discussion assignment, you're going to address this issue directly. That is, you're going to talk about your opinions on self-disclosure. Now remember, this is about your opinion, but you also need to incorporate some of the readings and at least one additional source. So don't overlook that part in the instructions. Also, be sure you include a discussion of the benefits and the potential downside to self-disclosure. I mean, if you're not aware of, and if you don't wholesome awareness of both sides, I think you're missing the point, because it's not an either or, one way is right, one way is wrong kind of issue. Okay, so for the week 4 assignment, I'm going to be talking about some really interesting techniques. And some of these techniques really start to skirt into the kind of advanced counseling and psychotherapy techniques, but this gives you a chance to start thinking about these things. So really, to me, there's really 3 techniques that we're talking about: confrontation, interpretation, and reframing. Now, in your instructions, interpretation and reframing are kind of lumped together, and I can see that in a way, but most of the time, in most sort of graduate level therapeutic texts, these are not really going to be lumped together. So feel free to think about them separately if you like. So confrontation involves, in simple terms, bringing to somebody's attention information that you think they need to know. There's also an implication that they might not really want to know it, or that it might not be so easy for them to hear. Otherwise, you really wouldn't be confronting them, so to speak, would you? Now, interpretation has a very deep history in psychoanalytic therapy. And so, you have to think about what are some of the definitions you see in the text in your readings and go by those. And just remember, there may be some other definitions of interpretation as a technique out there. And so just don't be surprised if you see those in your work along the way. Then finally, we have reframing. Now, some people might say that just about all therapy is about reframing in one way or another. I can see that argument. I don't think that's necessarily true, but there's certainly an element of reframing or offering a different perspective on what the client is talking about in almost all forms of therapy. So some really good things to keep in mind here. So talk about each of these techniques, and importantly, you're going to be interviewing a professional. So, ask some good open-ended questions so you can kind of pick the brain, so to speak, of the professional in terms of what he or she thinks about, confrontation, interpretation, and reframing. And I'll look forward to hearing what you have to say and what you learn. Okay, bye-bye. Have a great week.